So for International Women's Day, I thought I would talk a bit about how to accelerate your action, how to be listened to, how to receive the advice, support, information, treatment that you want. And what I realise more and more is that most women in many countries are just not being listened to, and they're unable to have the choice of treatment that they want. We've got a huge way to go before women receive hormones, which is first-line treatment for perimenopause and menopause for the majority of women. Many of you will know globally that only 5% of menopausal women receive hormone treatment. 5%, that is all. In the UK, it's 14%. In the US, it's hard to know the figures, but recent figures have shown it's as low as 1.8% of women. Now, we know from all the evidence, all the guidelines, that the majority of women benefit from taking hormones for two reasons. Firstly, for their symptom control, but secondly, for their future health. So why is it that it's 2025 and we're not receiving the treatment that will improve our symptoms and improve our lives and reduce our risk of diseases? There's many answers to that question, but I think more and more, as a menopausal woman myself, we really have to be our own advocates. We really have to think about how we can be listened to and how we can receive the choice of treatment that we want. Now, some people might not want hormones, which is absolutely fine, but every day I hear from women who do want them and they're not being allowed them, or they need a certain dose or a certain type of hormone and they're being refused. Every day in our clinic we speak to people, or people contact us because their doctors are now refusing to prescribe them the dose of hormones that they want or the type of hormones they want. Someone today messaged me and said that her GP practice's policy is that no woman can have testosterone. Now, I find all this really quite distressing and very sad, actually, that we've come to this stage and this time when there's so much refusal and rebuttal for an evidence-based treatment. I cannot think of any other area in medicine where people are refused. If I wanted to have a treatment for any other condition, I probably could receive it. And if I saw a specialist who recommended a treatment, then my GP would probably continue that treatment. Yet it's not happening with hormonal care for women, but also for men as well. And I think a lot of it is due to misunderstanding and also unfounded fears. But also a lot of it is because it's women, sadly, that women are not believed, they're not understood, they're not listened to, and not just in hormonal care, in other areas of medicine or for women as well. So I find it really difficult to know how to advise and help. But I think the biggest thing is for women to be empowered with knowledge, because we have guidelines called the Shared Decision-Making Guidelines, which are written by NICE. They're a few years old now, but they are still very relevant and pertinent to conversations that we have about hormonal health. What we need to do as patients is be central to our consultations and all our decision-making processes. And as doctors, we need to be facilitating the right treatment at the right time for the right person. And too often that isn't happening. Women have their choices taken away from them almost because they're not understood, they're not listened to, they're not always believed, but also their priorities and wishes aren't always taken into consideration. And with menopause care, with hormonal care, there's so much confusion still about what hormones do, what they are, and so forth. And I have done quite a few Instagram lives and podcasts talking about it, but we're only talking about three hormones: estrogen, progesterone, testosterone. They're three hormones that are made in our body in various tissues and organs, including our ovaries, but including our brain as well. And there's so much suffering with many symptoms that people experience. And too often people don't join the dots and realise that their symptoms are related to their changing and lowering hormones, especially mental health symptoms. Now, many of you know I've just come back from Australia, so I am a bit jet lagged, but I was reading some incredible articles actually, ones that I'd printed off a while ago that I had in my bag, and I was determined to read them all before I landed in Heathrow last night. And I read a really interesting article about the role of testosterone on mood and depression. And it showed actually for many years, even in the 80s, we've got evidence that testosterone improves depression. It helps the way that our nerves work in our brain. There's lots of roles that it has, but it's giving testosterone for people with severe depression, women as well as men, showing that they improve. And I feel really sad that this has been ignored for so long, and even now we've got the evidence, it's still being ignored, and other treatments are given instead, which actually have less evidence often associated with them. We know that our hormones work throughout our body. We know they affect every cell in our body. We know they reduce inflammation, they improve the way our cell processes work, and all our cells in our body work better in the presence of hormones. And mitochondrial function improves as well. And mitochondria are our powerhouse, if you like, of our bodies. We've got trillions of mitochondria, and they all have estradiol, progesterone, testosterone receptors on them. So we know that these hormones are biologically active. We know that when hormone levels fluctuate and reduce, a myriad of symptoms can occur. So women can often suffer. Yet often it's just normalised, and we're told that it's either in our heads because it's not related to our hormones, or we just have to put up with it and wait for this process to improve and abate almost, which is wrong, because for many women the symptoms can last for many years, even decades. There's no way of predicting how long symptoms can occur. But also, once our hormone levels are low in the menopause, they stay low forever, and this low levels of hormones increases inflammation, increases risk of diseases occurring. And these diseases are really relevant and important to most women because they include the commonest causes of death in women, so heart disease and dementia, but also there's an increased risk of autoimmune diseases, of cancers, of type 2 diabetes, osteoporosis, depression, bipolar, schizophrenia, inflammatory bowel disease, non-alcoholic fatty liver disease, Parkinson's disease. The list goes on really, and a lot of these are diseases of ageing, but they're more common in menopausal women. So it's really wrong that it's so difficult to be listened to and to receive hormones. And when we give hormones, we basically work out the right dose and type of each hormone, so estradiol, progesterone, testosterone for each woman. And it can be a bit of guesswork because blood tests can be a guide, symptom control can be a guide, but it can be difficult because sometimes the hormones can take a little while to have an effect because they work in the cells, but they also work in the nucleus. They work and affect the way our genes are, our genetic material as well. So it can take a little while to have the maximum sort of effect, if you like. But in medicine, we often try medicines and see if they help. We don't always know the answers in the first consultation. Sometimes tests like blood tests or scans can help guide us, but often it's how the patient feels as well. And that's something we've been taught quite early on in medicine. But somehow when it comes to hormone health, a lot of doctors seem to feel that they have the authority just to say no to people. And I can't quite understand why, because we know there are more benefits than risks of taking hormones. The natural hormones, estradiol, progesterone, testosterone, actually look the same under a microscope. They're the same chemical structure as the hormones we produce ourselves. So it does seem weird that we can't get our own hormones back, whereas many people, in fact many more people, are prescribed antidepressants, especially SSRIs, than they are HRT. Now, SSRIs have a lot more risks. We know there are risks of side effects, but there are long-term consequences of taking antidepressants, such as an increased incidence of osteoporosis, and also there can be problems with reduced sexual desire and inability to have an orgasm, which sound quite trivial, but it's not actually. It can really affect people's quality of life. Yet a lot of people aren't warned, and a lot of people are given antidepressants, but they actually really want their own hormones back. I'm not quite sure why doctors think they have the power and the authority to refuse evidence-based treatment. So, for example, the lady who contacted me today to say that their GP's policy is not to prescribe testosterone. I'm not quite sure how they can say that when there is evidence that testosterone can improve symptoms, and also testosterone is mentioned in the NICE guidelines. Increasingly, we see people who aren't able to be prescribed an actual certain dose of estrogen, and I've spoken about it on Instagram Lives before, that some women do need higher doses than others to have adequate absorption through their skin. Some people, especially who are young, are known to need higher doses of estradiol than others, for example, who are older. I had one lady who contacted the clinic on Friday, and she's young, she's had cervical cancer, so she's had her cervix, she's had her womb, her ovaries removed, she's had chemotherapy, and so she was floored into an early menopause because of her cancer treatments. Now, she's been on a higher dose of estrogen, which is what she's needed to improve her symptoms, and she's been told last week that her GP's refused to prescribe that dose. They'll only prescribe her a lower dose. But when she has a lower dose, her symptoms return, she feels dreadful, and her estradiol level's very low. When the estradiol level's low, it can increase future risk of diseases. So it does seem quite barbaric that she isn't able to get her hormones back. And this is happening more and more, actually, not just in the UK, but globally as well. Certainly in Australia, most of the doctors I spoke to do prescribe different doses of hormones, but they see people who are refused from other doctors, which is leading to more suffering from women. So what can we do as women to try and receive our hormones? There's a lot of misunderstanding about doses of estradiol. There's misunderstanding about testosterone and how it works in the body, but also about progesterone, and I have spoken at length about progesterone before. And progesterone is our natural hormone. It's produced by our ovaries, but also by our brains as well. And many women find a lot of benefit from taking progesterone. There are a lot of people that contact us in the clinic, but also me personally, saying they are unable to be prescribed progesterone because they've got a merinocoiling or they've had a hysterectomy. Yet progesterone works throughout the body. It can be very calming, it can be very anti-inflammatory, it can help induce sleep as well. And a lot of people miss it when they don't have it. I don't, again, understand why people will refuse the progesterone, but it is worth talking to your doctor and seeing if they can prescribe for you. Now, every time I speak to people, they always say, what are the best tactics for trying to be believed by a doctor and trying to receive the treatment that they want? So I think about this a lot, actually. And certainly as a patient, you don't want to fall out with your doctor. And certainly I also really believe that all healthcare professionals, all doctors, really want to do the best for their patients. Like, why would you be a doctor if you didn't want to do the best for your patients? A lot of people are resistant because they don't like challenge, they don't like to think differently, and they don't like to change their practice. And we all know how hard it is to instigate change. But certainly, I think the most important thing is to be really prepared for your consultation. I feel as a patient, you want to do as much homework as possible yourself. And that might take time, but really, when you know when your appointment's coming through, spend as much time as you can to find relevant information that's written by someone who's evidence-based, that doesn't have any conflicts or agendas. And that is really important because menopause information has become really, really diverse, they're very popular, but a lot of people are funded by pharmaceutical companies or funded by other companies, and maybe not evidence-based, or the evidence that they quote is not good quality evidence, or it might be old, or it might not be good studies. So try and work out exactly what you're reading before you take the information on board. But when you do, just work out before you go to the doctor what you want to get out of that consultation. And sometimes people they certainly come to the clinic because they just want to talk things through. They don't actually want treatment. They just want to talk through someone who's got a lot of knowledge and experience. But if you do want to start treatment, if you've decided that you want to start hormones, then have a lot of knowledge ready. And what I would always suggest is download our free Balance app. It's very easy to download. There's lots of information that's been updated all the time on the app. And complete a symptom questionnaire. Now, the symptom questionnaire is very easy to complete. And it really just allows us as healthcare professionals to see very quickly the most common symptoms that you're experiencing and whether they're mild, moderate or severe, because then we can concentrate on which are the symptoms that are affecting you most. But when you go to a healthcare professional, I would literally start the conversation by saying, I have come to talk to you about my hormones. I would really like to receive hormones and I would like you to prescribe for me. Once we've had this consultation, do you think this is something you would be able to do? Because then the doctor knows straight away what you're expecting to get out of that consultation. And some doctors still don't prescribe hormones or don't want to, or don't feel experienced enough, or don't have knowledge. And if they say straight away, well, that's something that I'm not experienced to, then you should ask straight away, who can I see? Who would you advise? It's unacceptable that people are waiting many months, even years, to see a menopause specialist. Every doctor, in my mind, should have knowledge and experience to prescribe hormones. If I said to you, oh, do you know what, I'm a GP, but I don't prescribe diabetes medication, or I don't prescribe medication for raised blood pressure, you would automatically think that I wasn't a very good doctor. So I do think it's inexcusable, actually, that doctors are not being trained in hormones, because it's not just menopause and perimenopause, it's PMS, premenstrual syndrome, premenstrual dysphoric disorder, PMDD, that's really important as well, and related to hormones. So we need to encourage all healthcare professionals to have education. We've got our Competence in Menopause course, there are other courses as well, but any knowledge is really important for healthcare professionals. So if your doctor does prescribe, the next thing is having the right dose and type for you as an individual. Now, many years ago, when I was a GP, I used to prescribe the same dose of hormones to everybody. I prescribed a combination tablet and thought that was fine. Obviously, fast forward 10 years or so, I know that everyone is different. So often the dose of estradiol, the dose of progesterone, and also testosterone can really vary between women. And it can vary whether they are perimenopausal or menopausal, whether they have PMS or PMDD. That can really vary, and sometimes we only start with one hormone, sometimes we start with all three hormones, sometimes we start with two, for example estradiol, progesterone, and add in testosterone, not forgetting vaginal hormones, of course, which some people need as well. So it really varies depending on each situation. But it is important to start somewhere. So some doctors might start with some low level of hormones, but then feel inexperienced to change the dose or to add in testosterone. And that's when it's worth asking, is there somebody I can talk to who really understands hormones? And it's often the review consultation. So after 3 months of starting hormones, that can be a really important consultation. And certainly when people come and see me in the clinic, that's when I spend quite a lot of time working out whether the dose and type of hormones is right for that person. We might often request for a blood test to be done before the consultations, we've got the results with us then. And that can be very useful for two reasons. Firstly, to make sure there's no other reason for symptoms. So it's really important often to check the thyroid function, check iron and levels, check vitamin D, for example, can be very useful. Also, it's to check on hormone levels, because if someone's still having symptoms and their estradiol level is low, then it often suggests that we need to change their prescription of estradiol so they can get more absorbed through the skin. And there's two ways of doing that. We might increase the dose, or we might change preparations, so from a gel to a patch, or from the patch to a gel, or even a different manufacturer of gel or a different manufacturer of patch. It can really vary between individuals. And also testosterone levels are a guide. They can really fluctuate between people or even the same person, but that can be helpful as well. I have quite a few people who contacted me saying that they felt great on testosterone, but they had their level done and it was slightly high, and their doctor has now withdrawn their prescription and told them they can't have it. If someone doesn't have side effects from testosterone and is getting benefit, then it often is safe to continue. The levels can really vary and they are just a guide. So if levels are raised, I usually recommend repeating the level and assessing for any side effects or any adverse effects of testosterone rather than just stopping it. We don't know enough information about levels. It depends on the way that they're tested, and it can really vary on the time that they're tested as well. And so a one-off blood test being high usually is not enough to really change treatment at all. The most important thing in medicine is looking at the patient and seeing how they are. We also know that hormones don't build up in the system, so they only last the day that we use them. So some people have said, my doctor won't give testosterone because they're scared that it's going to build up in the body. It won't happen with the natural testosterone. It doesn't work very long in the body. And testosterone, like I've said before, can take 3 to 6 months to have an effect. So it's worth persevering. And it's also worth just being reviewed after 3 to 6 months as well, just to see if the dose does need changing at all, because some people say, oh, the testosterone doesn't really help, but then we notice that the level's still low and they're not absorbing, and some people absorb the cream better than the gel or vice versa. So it is worth looking at options as well as dosing as well. Some people, when they start during perimenopause, their dosing might be quite low, and then they need to change when they become menopausal, when their own hormones decline. Because we're all different, we vary so much in our requirements for hormones. But like I say, the important thing is having that knowledge, so then you can ask for treatment from a healthcare practitioner who really does understand. I feel in 2025 we should be concentrating more on our own health as women. We should be looking ahead and trying to prevent disease. We should be looking at ways of trying to keep as healthy as possible. We need to take responsibility ourselves for our health as well. So we absolutely need to be thinking about what we're eating. We need to be thinking about any exercise that we're doing, how we can improve our exercise, maybe change the type of exercise, increase duration of exercise. But that's really important. We need to be looking at our mental health. We need to be looking at our sleep. We need to be looking at our social interactions, because these are important as well. And we need to look at any lifestyle habits. So we need to be thinking about smoking, drinking, and so forth. And all of these are crucially important pieces of the jigsaw, if you like, to try and improve our future health. So as doctors, it can be really rewarding when we help patients and they help themselves as well. We've got to be taking responsibility as patients to work with our healthcare practitioner, so we can show that we are responsible, that we do want to improve how we are. But we can't do everything alone. And it's not just about the exercise and the diet. It's often about having the right hormones as well. And if you aren't on the right dose, or you feel that you need the dose or type of hormones changing, then it certainly is worth speaking to someone with a lot of experience. And if it's not the right person that you see the first time, you can get a second opinion. It's quite fine to do that. And quite often in our clinic, we see people a couple of times and then they go back to their NHS GP, and then their NHS GP can see and hear how much better that individual is and then prescribe for them going forwards. And that's really important. So we have quite a few people who are refused HRT from their GP, hence they come to our clinic. And then when they're given the right dose and type of hormones, often with testosterone, and improve, then the GPs often have more confidence to increase or continue with their prescription and take over their care, which can be really good, because for most women, they take hormones forever. It's not something they just take for a short period of time. So going forwards, the more that your regular doctor can do for you, the better. But it might be that initially they haven't had the right training or experience. And so having a doctor who works with other doctors, like we do in the clinic, can be really, really useful, so that all doctors going forwards should, in an ideal world, be having more knowledge and also more experience about hormones. We need to demystify hormones. We need to be able to enlighten healthcare professionals and people about what they are and what they do in the body. So there's always things that we can do, but I do feel we have to be really good advocates for ourselves. If we want to have hormones, we shouldn't be refused. And if we are refused, we need to have enough confidence to go and see somebody else, because after all, we're talking about our future health as well, which is so important. It's not just a short-term fix, it's actually long-term preventing diseases, as well as helping people feel better, which often then enables them to function better at home, but also at work too. So I hope this Instagram Live is just giving you a bit of fire in your belly to think a bit more about how to be the best version of yourself, how to make your menopause as good as possible, but how to really advocate for yourself so you can be listened to and receive the treatment that you want. There's a huge amount of information on my podcasts, through my YouTubes, and on our website as well. And I've got some really exciting things happening that I can announce soon about my podcast and about my website, which I think you'll really enjoy and make it a lot easier to receive the information and knowledge that you want. So it will be so much easier to have a more detailed conversation with your healthcare practitioner. So enjoy the rest of your evening and have a great week ahead, and thanks for listening.